3 o'clock according to me. So shall we start, Paul?
And 3 o'clock according to me. Barcelona Standard Time. Barcelona Standard Time, 3 o'clock. UK, 2 o'clock.
Okay.
Do you want to start, Anna? And I'll be waiting for you here.
Perfect. Now, good afternoon, everybody, and welcome to this webinar. First of all, thanks a lot for taking the time to participate during these busy times, COVID times. So thanks for participating. So we are going to start. So today's webinar, it's an IPC and Watsan webinar focusing the preparedness of COVID-19 in the healthcare structures. In order to have a smooth presentation, I would ask you to mute your audios and also to close your camera. Okay, it will be easier. And like this, we are going to start. And I think, well, first we are going to do a very easy question for you in order to think about it. That is, are you sure that your healthcare facility meets all the minimum requirements? Okay, in terms of COVID-19 preparedness. So during this presentation, during this session, we hope we will help you to answer to this question. We have 3 main objectives for today. First is to present and to discuss with you the principles of IPC Watsan for COVID-19 in the healthcare facility. Also, we want to share with you a general overview of the existing documents and tools that have been developed for COVID-19. And last but not least, we would like really to know more about your questions and your challenges. So we are going to be together for 1 hour, and it will be divided like in 2 main parts. The first one will be like 25 or 30 minutes presentation, and then the second part we are going to focus on questions and answers. As you can see, the target of this webinar, it's including the medical line and the logistic line.
Anna, have you shared your screen? Sorry, Anna, have you shared your screen to everything?
No, I haven't. It's not. Okay. No, it's not sharing, so thanks. Perfect.
Sorry, go back to the beginning again. Just with the first slide.
Yeah. Well, we can go. This is the first slide. Okay.
Right.
The question, are you sure your healthcare facility meets all the minimum requirements? The objectives, to present and to discuss the principles, to share with you the general overview of the existing documents, and to know more about your questions and your challenges. Okay?
Very good.
Yeah. Here we go. So we are going to be together for 1 hour, and as I said, the first part will be this presentation, 25-30 minutes, and then we will go for questions and answers. And then, as I was saying, the target of this webinar, it's the medical and the logistic line at field level, which can include from capital, Medco, LOCO, and at project level, PMR, LTL, nurses, log hospital, and for sure headquarter people and technicians are more than welcome. So. And in order to be coherent with these medical and logistic target audiences, today the speakers, well, we are represented also the medical and the logistic line. So from the medical part, it will be me, Anna, who I am the IPC and nursing advisor based normally in Barcelona. And on the other side, we have
me,
Paul. Yeah,
Paul Jower, technical referent, Watsan advisor based in Barcelona. Sorry, the beard makes me look a little bit different from what's on the picture.
Yes, and now we are separated between Madrid and Barcelona thanks to COVID, but anyway, that's it. Okay, so for us, this first webinar, it could be like a starting point of many other sessions where we could tackle more in detail IPC and Watsan topics. So please don't hesitate to share with us your comments, your worries, and your inputs, because your feedback will be, for us, is really useful to help us to understand how to provide you better support for your COVID activities. Okay. While during the presentation, if you have questions or comments, just use the chat box that you have in the Skype. So we just have a better flow in the presentation, and then we will try to answer them during the questions and answer part.
Your chat box is located in the bottom left-hand corner of your screen. In your Skype screen, the little kind of bubble is your chat box. If you open that, you can put your questions there, and as Anna says, we'll respond to them at the end of the verbal presentation.
Okay, perfect. Thank you, Paul. So during the session, we are going to just to remember a bit how the modes of transmission of COVID-19, then also the IPC and Watsan elements that you need to take into account if you're going to prepare a healthcare facility for COVID-19. Also, we are going to raise the importance of reinforcing the IPC regular activities in your project. And the last point will be to show you where you can find the COVID-19 useful documentation. So we are going to start just with an easy reminder on how this virus is transmitted. I am sure that many of you are aware of this, but I think it's important for you to understand it. So like this, it will be easier for you to understand the measures that we need to put in place to protect the staff and the patients. So as you can see here in this first slide, the main transmission modes of COVID-19, based on the current evidence, the main routes are droplet and contact. Okay, it's true that there can be an airborne transmission, but with the current evidence, this happens when we are performing specific aerosol generating procedures, which are medical procedures and that are happening inside the healthcare facility. Okay. In this picture, you can see, I hope in a clear way, how the different modes of transmission. So the droplet transmission happens when a person is in close contact, meaning within 1 meter, with an infected person. That is by coughing or sneezing, is like releasing infected respiratory droplets that then, because of the short distance among these two people, they can be the mouth, the nose, or the eyes of the healthy person can be in contact with these, exposed to these infected droplets. Also, if you see here, in the contact transmission can happen either with the contaminated hands of the infected individual that after sneezing or coughing is not performing hand hygiene, so the respiratory droplets remain in the hands, or also because these droplets can also remain on the surfaces for several hours. So maybe if I go and I touch these contaminated surfaces, I can be exposed to the virus. And then, as I said before, the airborne transmission is happening by a smaller droplet that can travel more than 1 meter of distance, but it happens when we are performing specific procedures. So it's not like the main route of transmission. After this, we are going to enter now in the main section of the webinar, of the presentation, that are the elements that we all need to consider when we are in a healthcare facility dealing with potential suspected or confirmed COVID-19 patients. And for this, all the elements of the IPC and Watsan elements that we need to consider for preparation are organized like in 5 main areas or following 5 main principles. Okay. So first, the first principle is that we need to have an early recognition of the potential cases and a source control. If I identify a potential case of COVID, I have to try to do an early isolation. Okay, this is what source control means. Another principle or another main area is that we need to apply standard precautions for all the patients. The third one is that for those suspected or confirmed COVID-19 patients, we need also to apply transmission-based precautions. Another principle or another area that we need to consider is everything related with the environmental cleaning and the engineering controls, meaning all the infrastructure of the healthcare facility, but Paul will go more in detail in this section later. And the last principle is the administrative controls, that is related with how the staff is organized. Okay. So all these principles, the main objective is to mitigate the COVID-19 transmission in the healthcare facility. And for this, one of the most important things to remember is that MSF standards are the foundation for this. You will see that we are not asking to implement many new things specifically for COVID, but to ensure the IPC and Watsan basics, the standards. This is what is going to give us already the protection. Okay. Also consider that IPC and Watsan are very transversal and multidisciplinary areas. So we need a good collaboration and coordination between the medical and logistic lines, so all the activities are properly implemented. Okay. So if we go to the first principle that we said, it was the early recognition of cases and source control, this will include some elements. So at the entry point of my healthcare facility, we need to have a screening procedure in place. Why? Because this will allow me in a quick way to separate those suspected cases, meaning cases that are coming to the facility with respiratory symptoms, with fever, from others that are not coming with any of these symptoms. Okay, so from this first point, we do a separation of patients. Also, these patients with respiratory symptoms will go to a dedicated triage and waiting area until they pass to the consultation. Okay. In case these suspected or confirmed COVID-19 cases needs to be admitted in our hospital because of their condition, we need to do a source control. So for this is like I need to place them in a dedicated area, in an isolated, in the isolation area. So ideally it's in a single isolation room, but we know that this is very challenging in the field and many times it's not really feasible. So what we can do, if this is not possible, is to place these patients in cohort wards. What is a cohort ward? A cohort ward means to have a common ward where either I have suspected COVID-19 cases or either I have confirmed COVID-19 cases. Okay, the most important thing is not to mix suspected and confirmed cases in order mainly to protect the suspected cases. Okay. Also, for those patients that are admitted in the isolation areas, we need to limit, to do a limitation of their movements within the healthcare facility. So they can only have some movements in specific areas and following specific circuits, okay, in order to separate the COVID and non-COVID area in a clear way in our healthcare facility. And also it's very important to have a limit of visitors, so only to those essential for the patient support. And we all know that we are aware that in many projects, caretakers or visitors are not going to be allowed. So, but in case they are allowed, there should be a limitation. And for sure, what is very important is that these caretakers should have also passed by the daily screening in case, just to detect on time if they are also developing respiratory symptoms. These elements are critical because are in the entry point of the healthcare facility. So so they really can determine how the rest of the IPC practices are implemented in the healthcare facility. Is one of the critical points that we need to pay attention in the entry points of our facility. You can see it here in a maybe more visual way. So you can have the screening area and then two completed different areas. No, the one that is having for all the suspected or confirmed COVID cases, from the triage, waiting area, OPD consultation, and hospitalization in case they need to be admitted. And in case, and for those patients that they don't have criteria to be suspected, they should be consulted and admitted in different areas of the healthcare facility. Okay, so there is not a mix between them. The second principle that we said before is that we need to apply standard precautions for all our patients in the facility, okay? And this by all staff, medical and non-medical. And we need to focus on three, even if all of them are important, but for COVID, we need to focus on hand hygiene, on respiratory hygiene, and cleaning disinfection. And this is very related on how the virus is transmitted, because if you remember the slide where I was explaining a bit the modes of transmission, you probably will remember that the contaminated hands can be one of the main causes of cross-infection. The droplet, the respiratory droplet that we experience by coughing and sneezing can also, be the cause of cross-infection, and also the surfaces where the virus can remain there. So if they are not clean and disinfected properly, the longer the virus will be there. For the hand hygiene, that as always is the most important IPC measure, not only for COVID, but for everything. Remember that it has to be reinforced not only for the staff, but also for the patients and for the caretakers in case they are allowed to stay with the patients, okay? From our side, it's really important that if we are going to encourage the people to perform hand hygiene, we need to ensure that the material is available in strategic places. So we facilitate these hand hygiene practices. So especially in all the entry points, the waiting areas where in the triage, waiting for the consultation, the toilets, isolation rooms, cohort wards, and donning and doffing areas. These are very critical areas where we need to ensure that hand hygiene material is available. In the cohort wards, remember, where we can have either suspected or COVID or confirmed patients, we suggest you to have like hand hygiene stations every 4 to 6 beds with alcoholic hand rub solution, because it will facilitate the staff to perform hand hygiene without moving a long distance within the ward. Okay. So please remember that the standard precautions are the basics for all IPCs. So if these are not properly implemented, it's very difficult that the rest of the measures will work properly. Then the third principle that we said is that for those suspected and confirmed COVID cases, we need to apply transmission-based precautions, always in addition to standard precautions. Okay. As we said that the main transmission routes are droplet and contact, what we need to do for routine care activities, or if I am a cleaner and I am working in an area with COVID-19 patients, I need to have a PPE that is going to adapted for droplet and contact precautions. So here we use these nice two colleagues that are with us. You can see that they need an eye protection that can be either a Google or a face shield. They have a medical mask, the isolation gown, and the gloves. Okay, so it's protecting all the areas that can be exposed when we are in close contact with a COVID-19 patient. In case that a medical staff, for example, she is a nurse and is going to perform an aerosol generating procedure, okay, that we said it can have a transmission, an airborne transmission. The only difference in terms of PPE that we need to take is about the type of mask. In this sense, we need to use a respirator, that is a specific mask that give us protection for this type of airborne transmission. But the rest of the elements are the same, because the contact and the droplet precautions need also to be ensured here. Okay, but anyway, this is only during the procedure of this aerosol generating procedure. Okay. In terms of PPE, what is important, of course, apart of having the material available, is that we need to train all the staff, including the cleaning staff, about how to use properly the PPE, because we can have the PPE available, but then if we don't know what do we have to use based on which activity, and how we can do the donning and the doffing, then we can have a risk of cross-contamination here. So the staff training is one of the key points. Also, we need to have donning and doffing station in specific places, so the staff can put on and take off the PPE whenever is required, always with hand hygiene material available. And in case that you are dealing with shortages of PPE, that we are aware that this is a quite common scenario now, at field level you need to discuss and to see which could be the best strategies to deal with these shortages that normally require either extended use of the PPE or reduce of PPE until the stock is enough to do the standard procedures. In terms of key messages that I would like to share with you for the PPE are two. It's like you need to use the right PPE combination by the right staff and at the right time. Okay. And very important is that we need to remember that inappropriate use of PPE what can give us a false sense of security and is going to distract us from other effective protective measures. As for example, if you are using the whole time gloves for whatever, no matter what, the whole time, and instead of washing your hands, okay, so you are moving with contaminated gloves instead of performing hand hygiene. This is a very common example in the field. And I think now Paul is going to continue with the presentation. So Paul.
Thank you, Anna. It's time for you to catch your breath for a little bit. That was quite interesting for the first 5 things. So now I will take over and talk about the Watsan part of this intervention. And it's interesting to show, the reason why we did this presentation is to show the close links between the logistical and the medical side of things. So just to enforce that, me and Anna have been doing this together, so it should be done between the log and the med. So the first thing to look at are the circuits. Then there's ventilation.
Oh, sorry.
Sorry, with circuits.
It was my fault. Yeah, yeah.
Okay, it's no problem. You must take that thing off the middle of the screen. Thank you very much. That's okay. Just go that. Okay. So circuits.
Okay.
So in the circuits, you can see a little drawing in the top right-hand corner as a kind of example of a circuit. It's just showing that there should be designated contaminated COVID-19 and non-contaminated areas inside your health facility if possible. So in the little picture we have on the side there, it shows a changing room and a donning and doffing before you get into the contaminated area. So this is just giving you a little example of what it could look like. It should be signposted and clearly defined routes and areas and restricted access. Signposted even outside the health structure and after triage, so people understand how to find the place, and also the routes around. You can put signposts to show to make sure there is no mix-up between who's going in which direction. The next one is the medical and logistical. We're working together, clearly understood all the circuits and timetables. So the staff has timetables, they have schedules and rotas and rosters which they have to hold to. And also the circuit the medical follows might not be the circuit that the logistical follows, which is the next point. The logistical circuits, for example, the circuit for laundry. So how they take the laundry to and from the donning station or to and from the doffing station, or what happens to the waste, how is the waste taken out and handled correctly, all has to be finalized and agreed with everybody, so there's no chance of contamination through the laundry and waste handling. And important here is the decision and design. All this COVID-19 stuff is very transversal. The design and the decision on the designs involves everybody, the medicals, constructions, Watsans, IPC, everybody involved in the design to make sure that everybody knows the items that have to go into the production of a safe circuit. Next, please. Okay, the next one's ventilation. As Anna said earlier, people sneezing and coughing will spread the disease droplet-wise. So all the areas should be well ventilated, if possible. Ensure the natural or hybrid ventilation in all areas. The hybrid one would be like not an internal fan. Hybrid would be like a machine that will suck the air in from outside and force the air outside as well, like an air conditioner or something like this. Ceiling and standing fans, I said, must not be used because all that does is circulate the existing air inside the room. So that would just, if someone sneezed, it would mix it with everything else, and then you'd have a problem of contamination. The next point is the central air conditioning system should only be used if it's only on the setting of 100% fresh or clean air. Do not use an air recirculation system, because again, that will just replenish the air with air that's maybe contaminated by the virus. So that's the idea of the ventilation. There's a lot more things to go into with ventilation, which we can go into at a later date. One of the ideas of this presentation is to stimulate your questions and stimulate your requests for other more detailed webinars, because I don't want to get into subjects like air exchange and, you know, it has to do 6 or 10 cycles a day, an hour for the air exchange. So let's just keep it as that for now, and if any further questions, please put them in the chat box. And the next slide, please. Water and sanitation. So as usual, as Anna was saying, it's the usual standards: ensure reliable water quantity and quality, which is free residual chlorine. But in this case, it's above regular standards. For example, the water quantity in a coronavirus is advised 150 litres per person per day. But the free residual chlorine is still the same as we always have, as 0.2 to 0.6 milligrams per litre of free residual chlorine, depending on the temperature, obviously. But that's the normal standard, normal MSF standard, except for the quantity of the water. Then you have, if it's possible, have exclusive latrines and showers for COVID, if possible. It has been shown that maybe when you flush a toilet, if it's a toilet flush, some droplets might come out, but if it's exclusive for the patient, that's fine. Safe solid waste management, which would be latrines or toilets, but the virus can still survive in human feces, so it's good to be very careful and safe with the black water taking away. And then you have the normal wastewater management, which is grey water, which is from washing and soap and laundries and stuff like this, and rainwater has to be handled properly. The next one is hazardous waste, from procedures and medical waste, which I'll go on to later on the next couple of slides. And also, if you're going to have an area, it's good to anticipate the vector control activities, because if you have patients inside a coronavirus, you will not be able to spray insecticide or do the normal practice for IRS. Okay, Anna, please, next one. So environmental cleaning. The key part of environmental cleaning is actually those 3 arrows you see in the top there: high to low, clean to dirty, outside to inside. It's the standard MSF, as always, it's the standard way of doing the cleaning. But of course, you need to have the cleaning equipment available, either Cephanios for more high-risk areas, or NADCC, which we try to use most, or HDH, which you all know, bleach or other validated products. And then we have the mops and the buckets, make sure the cleaning equipment is available. And if it's possible, have a dedicated cleaning and disinfection material for the COVID area and the non-COVID area, so you don't mix it. And as I said before, following the usual MSF protocols and standards, like the 2-bucket method of cleaning, cleaning from the clean area to the dirty area, cleaning from the top, which is clean, to the bottom, cleaning from low risk to high risk. So all of that is normal standard MSF standards. The only main difference, the last line, the only main difference is the frequency, the daily frequency is twice as normal. So we've kept all the concentrations, all the methods, all the things the same, except for the frequency. Next slide, please, Anna. And here we have the waste disposal. Obviously, the segregation has to be enforced, and the material is available in clinical areas. So the buckets can be, or should be, color-coded and well labeled, so we know the difference between soft and glass and organic and infectious waste. And have reminder posters telling people what should be in each bucket, as per usual MSF standard. We have waste collection points, obviously in the waste zone, or temporary collection points in the isolation area if you have a very big structure, or when the waste zone is outside the isolation area, you can have a special set collection point. And then you have medicals and logistics are clear on the responsibilities on the waste and segregation, and the transport and the final disposal of the waste. That's quite straightforward. The medicals are usually in charge of segregating and putting the waste in the bin, and it's the logistical responsibility to remove the waste and take for safe disposal. This is all usual standards, just to clarify. One thing you should be careful of, you see in the bottom right-hand corner, the waste management area should be dimensioned according to the needs of the centre. This is because the disposable PPE and the other material you produce might be more than what you're used to in a normal health structure. So you might have to size up your waste management area slightly for the burning of the soft waste. Okay, I tried to go through this quite nicely. There's another one, please. And then I tried to do this very quickly, but it's enough space for you to ask questions either now in the chat box or later on. Ask questions about the Watsan if you have any further in-depth questions. Thank you, Anna.
Thank you, Paul. This is the administrative controls is the last area or the last principle that we presented before, okay? And it's mainly related on how our staff is organized inside the healthcare facility and what is the training that this staff should receive, okay, for the preparation. So we should have as a first point, if possible, dedicated healthcare workers, including cleaners, for COVID areas. So we are not only dividing the structure physically, but also in terms of staff. The staff who is working in the COVID areas is not going to the non-COVID areas. At the same time, this division of the staff, what is going to help us is to have a limitation of the staff movement. Okay, so in general, we want not to have a lot of movement with patients, visitors, and also with staff. Okay, so if I am working in the COVID areas, I am not visiting the non-COVID areas for whatever reason. It's also important to adapt the staff ratios of the medical and the cleaning staff according to the needs. This is a general principle for all medical activities, even outside of COVID, but maybe if we are going to foresee an increase of patients and an increase of workload, also of cleaning frequency, we need to calculate this, okay, and to adapt it, and to cover 24 hours, 7 days per week. Another important point is try to minimize as much as possible the aerosol generating procedures, because as I explained before, that is the risk of cross-infection with an aerosol generating procedure is higher than if you have than the other transmission routes. So if we can avoid them, or we can just reduce also the staff that is involved in these procedures, it will also reduce the risk of infection of our staff. Okay, and then it's also important to monitor the IPC practices among the staff, how we are respecting the standard precautions, especially the hand hygiene, the cleaning and disinfection, how we are using the PPE, the donning and doffing. All these things, they need to be monitored so we can provide feedback to our staff in case we detect improvement points. Okay.
Okay, so do you want me to do a little bit on the training?
Yeah.
Okay, in the staff training, we have to ensure the staff, including new staff, are all trained, and staff, we mean med and logistical staff, trained on the COVID and the non-COVID areas and circuits, which I talked about the routes, the laundry and the waste and the medical circuits as well. Hand hygiene has to be retaught and refreshed. Cleaning and disinfection, as we said, with the new double roster, double frequency per day. But other than that, it's standard cleaning and disinfection. The correct use of PPE, as Anna was talking about earlier. Waste management, how to move the waste in the bins and the systems like that. And the self-monitoring of systems and symptoms, self-monitoring of symptoms so they can have a early diagnosis if they have any problems themselves. Mm-hmm. Okay, Anna.
Okay. So now we have presented already like the main IPC Watsan elements that we should consider for COVID-19, but we think it's also important to reinforce the IPC regular activities in our projects. Okay, not because anyway, even the healthcare acquired infections, a part of COVID can continue there, and the protection of the staff and the patients continues being important, not only for COVID. So the principle that we want to pass to you, or the mantra, let's say, is like, you continue doing what you are doing correctly, okay? Because there are not so many things that are new and that are specifically for COVID. So please continue doing your regular IPC and Watsan assessment in your facility to understand which is your situation in terms of IPC and Watsan. Develop or adapt your action plans based on the results of these evaluations, and do a progressive implementation and monitoring of this action plan, and then reevaluate again which is your situation in the healthcare facility to see which has been the impact of this action plan. For this, the main, let's say, the governance of all this is our friend, the IPC committee, which is also something that we need a multidisciplinary approach. So we encourage you to continue doing these standard practices, and not because COVID is arriving, forget them, because this is really what is going to give continuity to these practices. Okay? Paul, do you want to add anything else here?
No, that's fine. It just shows a very nice picture of a logistician and a medical working together, and they're both part of the IPC committee.
Okay, sure. Here it's because all the we would like to present you this IPC and Watsan COVID preparedness checklist. That is the document that we have used to prepare this presentation, and you can find more detailed information than the one that we have presented you, but it's following the same structure. So please don't hesitate to use it, and if you have questions or comments about it, let us know. You can find it in the link there. Finally, we would like to just to share with, or to show you where you can find the main COVID-19 documentation. Okay, so I guess many of you are already familiar with the OCBA COVID-19 hub. You have the link in the slide, and if you click to the link, we are, now that IPC and Watsan is coming so trending topics thanks to COVID, you open the hub and you will see that we appear like in the first page. So you can just go to the infection prevention and control section, and there you have all the IPC and Watsan documents and tools, okay, that can help you to do the implementation of the activities.
And also on that, we might have some more information coming in later on, and when we update it, it'll be updated in that area in the SharePoint. Okay, sorry, now my point, just a few important tips just to remember about COVID-19 and your response. Just 3 simple little tips. If you come away with these 3, then things will be a bit easier. Supply. Try to ensure that you order all the material you need in time to respond, and monitor regular consumption so you can reorder. It sounds very basic, but in COVID, you're going to be going through a lot more material than you usually expect, and some material might be difficult to get hold of. Number 2, as we said, it's multidisciplinary. The best response is completely transversal, meaning it includes medicals, Watsans, construction, biomed, electricity, etc., etc., etc. Every family has to be considered in the correct design of a Coronavid. Step 3 is standards. As we're saying again and again, standards are essential. Remember, the best ways to respond is to uphold the usual MSF standards. There are only very small differences in COVID-19 response out the standards. One of them I mentioned before is increasing the frequency of cleaning, but everything else, if, as Anna said, if we continue doing the right thing correctly, we will have it stamped out. Okay, good. Anna?
No, thanks, Paul. No, I think now, our presentation has finished, and now I think the most interesting part also, at least from our side, is to share, to know your doubts, your questions, and your challenges. So let's see if you have put some questions in the chat box.
Yes, they have.
Yeah, okay, but anyway. Thanks for your attention anyway.
Thank you very much for your attention. We're not signing off yet. We're going to be here to try and answer the questions on IPC and Watsan. If we cannot answer the questions directly, we'll collect your information and then we can answer you straight from person to person if it gets out of hand. But some people will be interested to hear the answer.